really gratifying for all of us physicians to be able to offer yet another option, or maybe in some cases the only option for folks who've been suffering with aortic stenosis, who've been short of breath and, you know, almost counting their days as to when this disease is going to take over their life. The U.S. Food and Drug Administration approved transapical transcatheter aortic valve replacement on October 19th, just a few weeks ago.
Appropriate sheath size available?
Yes.
There were actually two very important things that happened that day. Number one, the indications for transcatheter aortic valve replacement were expanded to patients who are high risk, beyond just patients who are inoperable. So initially we were only able to do this in patients who absolutely can't have open heart surgery because they're so sick. Well, the FDA went a step further based on the research and the clinical trials that have been done and said, well, now less sick patients, patients who are high risk, can be done. That's very, very good news for many patients who are sick but not sick enough for the original indication, but now they may have this type of procedure. Transapical transcatheter aortic valve replacement was approved, and that's just a different way for us to put that same valve in to the heart, where it takes the place of the bad valve in folks with aortic stenosis. And that also allows many more patients to be treated with this, because many folks can't have a procedure from the groin, the transfemoral approach, because of calcification or disease in those vessels. More patients are able to be treated with this minimally invasive surgical procedure who otherwise really didn't have much of an option.
It's a whole team approach. We have interventional cardiologists, we have surgeons, we have anesthesiologists, and everybody is absolutely essential to the performance of this procedure.
It's minimally invasive procedure compared to the conventional open heart surgery. It took about a third of the time that it would normally take, so it's less anesthesia, less medication, quicker recovery. The patients win all the way around in this type of a procedure.
Dr. Kempe and Dr. Phillips, who are two of our cardiovascular surgeons, each did a case and did a great job. We have great positioning of the valve. The valves are functioning normally and it's very exciting. There was excellent outcomes. Dr. Mohammed, the head of our structural heart program, has led this team, and so far all their cases have been successful cases. So we're very excited. This expands the opportunity for patients to get their valves fixed, and it's really a big achievement.